Hi, my name is KHAIRIL LATIFF. I'm a first year medic student and my metric number is BM2411009. So, this is my presentation that I'm going to explain about dermatology. So, without further ado, let's jump right to it. These are the contents that I'm going to be explaining in my presentation. The introduction of dermatology, skin histology, skin physiology, clinical significance, and then the specialists in the field. What is dermatology? Dermatology, or if we cut it in half, we got the derma and the ology part, which means derma means skin and ology means the study of. So combining it together, we will get a meaning of a medical branch that specializes in dealing with condition that affects the skin, hair, and nails. So the skin itself is an incredibly large and very functional organ. It is the first line of defense against disease, protects organs, warms and cools down the body, and sends messages about how healthy someone is inside. And because of dermatologists understand that a skin condition can have a serious impact on health and well-being, as some skin condition might be a sign of a serious underlying health issue. So basically what I'm trying to say here is that skin is an important part of our body. Without the skin, we would not have the protection against pathogens and any basic physical traumas. And also it will help us to diagnose something easier. The skin histology. So generally speaking, skin has three layers, which is the epidermis, dermis, and hypodermis. By the name, we can understand that epidermis is the most superficial part. Dermis is the middle part, and then the hypodermis is the deepest part. So these layers of skin are composed of epithelium, connective tissues, muscles, nerve, blood vessels, and associated structures such as glands, hair follicles, and nails. In this skin histology, we have to know that there's two types of skin: thin skin, and then we have the thick skin. So in thick skin has a thinner dermis than thin skin and does not contain hairs, sebaceous glands, or apocrine sweat glands. And then we got the thin skin, which is a which has a thicker dermis. It contains hair, sebaceous glands, and apocrine glands. Actually, there's a lot more for me to explain. For example, if you can see here, it says that it has a sweat duct, it has an erector pili muscle, it has sebaceous glands, um, it has acrine and apocrine sweat glands, and many more. But generally speaking, we are just trying to differentiate between thin and thick skin. The layers of the skin. As I just mentioned just now, there's epidermis, dermis, and hypodermis. So what's the difference between these three layers? So epidermis is the most superficial layer of the skin. From the deepest to the most superficial, we have the epidermal layer, which are the stratum basal, stratum spinosum, stratum granulosum, stratum lucidum, and corneum. All of these layers has its own um, specificity with its own function. And then we got the dermis. The dermis is connected to the epidermis by a basement membrane. The dermis consists of two connective tissue layers, which are the papillary and reticular, the which is merged without clear demarcation, which we cannot really see the merging, but it slowly merged into one. So trying to find its separation is very hard. Then we got the hypodermis. Hypodermis is the most deepest layer of the skin, also known as the subcutaneous fascia. This layer contains adipose tissue, uh, adipose lobules, sensory neurons, blood vessel, and skin appendages. So for example, is hair follicles. So these are the picture as we can see. These are the epidermis, dermis, and hypodermis, which we can clearly see the hypodermis can only be we can only see some artery and veins and some fat tissue. It's hard to see other structure in it. Then we go to skin physiology. So, what is physiology? Physiology is the process that occurs in the body or on a certain organ that has a system of uh, positive or negative feedback that tries to balance out the internal environment of the body. So, skin physiology, we have vitamin D synthesis, protection, and thermoregulation. So, how do skin does vitamin D synthesis? So, first, ultraviolet light converts ultraviolet light touches the skin, and then it converts 7-dehydrocholesterol to cholesterol, which is the vitamin D in the skin. This process is essential uh, because it maintains bone by osteoblasts. And then we got the protection. This is the most common thing to know. Skin protects the body by forming a waterproof layer, which protects the deeper structure, prevents dehydration from loss of water. This is due to the keratinized epithelium in the epidermis. Next, we got the thermoregulation, kept at a remarkably stable core temperature even in extreme heat through a negative feedback system involving the skin, skeletal muscles, sweat glands, and the hypothalamus. We can imagine that thermoregulation is like when we have a very high body temperature, we will sweat more. So we will reduce the heat in our body. And then next, I'm going to go to clinical significance. Since skin plays a crucial role as the first line of defense and the most exposed organ in our body, chances of skin disease are high and has many complications. So in this part, I will be covering about disease, the diagnosis, and the treatment for it. So the disease that I choose to explain is skin cancer. There's three main types of skin cancer, which is the basal cell carcinoma, forms in your basal cell in the lower part of your epidermis, which is the lowest part of the epidermis. And then the squamous cell carcinoma forms in the squamous cell in the outside layer of your skin, which is the most top one. And then the melanoma. Melanoma forms in melanin producing cell. This is the most serious type of skin cancer because it can spread to the areas of the body. As you can see, these are the pictures. We can differentiate between the three. The melanoma is a lot blacker. Squamous cell is more red. And then basal cell, you can barely see, but it's got an inflammation on. And then the symptoms. How do we know if it's a cancer, skin cancer? So the formation of new mole, pearly or waxy bumps on skin, flat pink, red, brown patch or bumps on your skin. So what causes this skin cancer? The skin cancer is caused by overexposure to sunlight, frequent sunburn, family history of skin cancer that can influence as well. So how do we diagnose this? By using non-invasive and invasive methods. Non-invasive, such as examination, or we can use dermasensor, which is a technology that uses the light spectrum to see how a cell reacts to the light, how it spreads the light into a spectrum, and it can determine whether it's a cancer cell or not. And then through examination, we can do just palpate around your whole body to determine whether there's a bumps or there's an abnormality around your skin. And then biopsy, of course, it uses the cell that is suspicious to test it in the lab to see whether it's a cancer cell or not. And then We will go into the treatment. Mostly skin cancer treatment, there's no such thing as healing it. All we can do is trying to kill the cancer cell or trying to kill the part that is infected by the cancer cell. So what we can do is using cryotherapy, which uses liquid nitrogen to freeze skin cancer that cells love after the infection. Then we have photodynamic therapy. Specialists will coat your skin with medication, which they activate with a blue or red fluorescent light, restoring our precancerous cells. So how do we prevent ourselves from getting this skin cancer disease? What we can do is we try to minimize our um, exposure to sunlight. Lah. How we do that is by using sunscreen and avoid tanning. And logically speaking, we know that sunscreen blocks UV light from entering, touching our skin. So yeah, we have to use it and make sure to use SPF 30 and above because SPF 30 is a factor for sun repelling. And then avoid tanning. Of course, tanning is still considered exposure to sun, so it could cause it still will raise the risk of getting skin cancer. Then lastly, I'll be explaining about the specialist in the field that I choose, which is Dr. Sandra Siupindi, or commonly known as Dr. Pimple Popper. Many people do know her as Dr. Pimple Popper because she made a lot of contents about pimple popping in the YouTube, and she also has her own show about pimple popping. So her qualifications are graduated for her Bachelor of Science in 1993 at University of California, Los Angeles, graduated for her Doctor of Medicine at Drexel University, Philadelphia, Pennsylvania in 1998, fellowship at Drexel University and internship at Allegheny General Hospital in Pittsburgh. She also has certificates such as board certified dermatologist and Mohs surgeon. She's a certified dermatologist and a fellow of the American Academy of Dermatology, American Academy of Cosmetic Surgery, American Society for Dermatology Surgery, and the American Society for Mohs Surgery. Then that's pretty much what her qualifications and certificates are. She's a very well-known specialist and a very successful one too. And the reason I choose her because I was um, I was inspired to be a dermatology doctor because of her. And that's all for me. Um, Thank you for watching. And these are the references that I uses to make my slides. Thank you for your attention.